From saying that it wasn't worth it to wishing that they never thought about it in the first place, here's why patients regret doing cosmetic limb lengthening surgery. Hey, what's going on guys? It's Victor here, and today we're gonna go over the top reasons why patients have regretted getting cosmetic limb lengthening surgery done. All right, so the first reason why patients regret stature lengthening is due to complications. Despite the majority of successful surgeries we hear about, many patients have experienced unexpected complications during and after lengthening. From infections, to nerve damage, to muscle contractures that need soft tissue releases, to malalignment, to non-unions, you name it, it's most likely happened. And many of these complications can lead to long-lasting pain and discomfort, essentially crippling you. So why do complications happen and how do you avoid them? Two main reasons. One is sometimes they just happen, which is very rare, but most of the time it's due to inexperienced surgeons who lack the troubleshooting ability, or maybe they're patient pleasers, which means that they succumb to patient pressures who want to reach their lengthening goal at all costs. This is why it's important to select an experienced surgeon from the get-go, because I know patients who got lengthening done at questionable clinics and needed 2 or more additional corrective surgeries afterwards, which cost more time, money, and scarring than if they would have selected a good surgeon from the beginning. The next reason why patients have regretted their decision to get limb lengthening surgery was due to the fact that their proportions were skewed to the point where they just didn't like their look. You gotta remember that this is a cosmetic procedure and that aesthetics do come into play. So if you're particularly worried about your proportions almost as much as or more than the height that you're after, you could potentially cause some anxiety for yourself, essentially creating a proportion dysphoria. I've spoken to patients who've lengthened one bone segment, say their femurs, about 8 centimeters or so. Then they take a look after they're able to stand and walk, and well, they hate it. Most of these guys would typically opt to do the other bone segment, say their tibias, to help balance it out, while there was actually a few who've actually considered limb shortening to reverse the effect. I really feel bad for these patients, I really do. I mean, here they are, they sought to get taller with a tolerable look of their proportions. However, some ended up with distorted proportions that they can't stand later on down the line, and well, they wish they could take it all back as if they bought the wrong pant size. This is why I preach my most powerful piece of lengthening advice: lengthen and observe. Another reason why patients regretted lengthening was because they feel like they didn't get enough height. Most patients in this category either face some sort of complication, such as a severe muscle contracture that forced them to stop, but there were a few who couldn't tolerate the rigors of lengthening, and even some who thought they were gonna be satisfied with whatever length that they stopped at, only to realize that their dysphoric thoughts returned later on. In fact, I remember a patient who was lengthening his tibias, but the pain bothered him so much that he wanted to stop at 1 centimeter, like 1 centimeter. Then after he recovered a bit, he realized that he wasn't satisfied and he wanted more height, and he wanted to go back, get a re-break, and lengthen more. The only problem was that he had a slight axial deviation and an apex deformity on his tibia. So I'm not sure if this patient ever got that corrected and lengthened again, but he was definitely stressed by it all. And there were others who were just exhausted from the process and called it early. Limb lengthening is not an easy process by any means, but I think if you can manage your pain well early on, do your physical therapy, avoid complications, you'll make it through okay. You'll be really, really happy on the other side. Now, the final reason why patients regret stature lengthening is having unrealistic expectations. Many prospective patients might see a cool video online with some time lapse of other patients, and think, hey, look, that doesn't look so bad. I can just pay this much, get my legs broken like this, and get back to normal life. Unfortunately, that's not how this works. This isn't a drive-through, it's a life-changing procedure, and something that big requires an all-in mentality. Patients in this category are those who don't consider the amount of time that it's gonna take to get to full recovery, or just how limited their mobility is gonna be and how difficult it's gonna be to do things safely. The recovery process was much longer and challenging than he had anticipated, and it significantly impacted his daily life and career. Guys, you need to realize that you're not just breaking your legs, you're lengthening them as well. So that comes with a lot of unknowns. I found that the average amount of time that it takes a femur patient to lengthen 8 centimeters without complications and a non-weight bearing nail to get back to walking, just without assistance, is about 6 months. And to do so normally to the point where no one will notice can last anywhere from 7 to 9 months. This takes time. Give it time. All right, guys, that's pretty much what I got. So as you can see, although limb lengthening does produce a lot of really happy patients who say it was one of the best decisions of their life, there are some not so happy patients, and now you know the main reasons why. If you heard of any other reasons, be sure to leave them down in the comments below. I hope you found the video helpful. If you did, go ahead and hit that like button. Be sure to subscribe, and until next time, this is Victor from Cyborg for Life, signing out. Peace.